So you also have a class of drugs. It's not just one type of drug, but sometimes you have like drugs that have similar activities or they work in similar ways. So that's what we call a drug class. So one of these classes of drugs are things we call sympathomimetics, right? And sympathomimetic sounds like mimic, right? Or mime, like those creepy French clowns that do that, like, and pull that rope thing. So like they sound like that mime, like they're mimicking, they're acting like something. So this is what with the sympathomimetics is that they act like your sympathetic nervous system. So these are adrenergic receptor agonists, but they're not the same as your natural sympathetic nervous system. But they activate the same receptors, so that's why they're mimetics. So they're going to activate adrenergic receptors, alpha or beta receptors, and they cause sympathetic effects, so that's why it's sympathomimetics. So it includes things like amphetamines, pseudoephedrines, MDMA, so a lot of these recreational drugs, like I remember back in San Francisco when I was in grad school, you could tell who was like on something because like it was like, wow, it's like 40 degrees out, but they're sweating up a storm, they're shirtless, and their pupils are freaking huge. And why? Like, oh, yep, they definitely have some sort of sympathomimetic in their system. But yeah, that's what sympathomimetics do. Notice that a lot of these are, the colloquial term is also uppers. Notice that a lot of them are kind of stimulating these, and this is why sometimes the people experience cardiac arrest. They're taking so much of these drugs that their heart overloads and it just stops altogether. So that's why sometimes there's, I mean, I haven't heard too many stories. Like all our news is occupied with other things right now. But once in a while, like when I was in grad school, you hear about somebody taking one of these things for the first time and dying. Well, that's why. And then sympatholytic drugs. So what these are antagonists. So lytic sounds like lysis, right? So lysis, it means breaking apart. So these are kind of like breaking apart the sympathetic response. So these are antagonists. They bind to the same receptors, but instead of actually activating them, they're binding to alpha and beta receptors, but they're blocking adrenergic receptors. But sympatholytics. So these drugs, instead of actually activating the sympathetic nervous system, it's going to tone it down. So it's in there, not the same as parasympathetic, but it's going to basically just like pull sympathetic activity lower. And indirectly, so again, it's not quite the same, but produces parasympathetic-like effects. So in dually innervated organs or tissues where they oppose each other, yeah, a sympatholytic is going to act like a parasympathetic activity, but they're more indirectly. It's more just due to blocking sympathetic activity, not necessarily increasing parasympathetic activity. So these are often called blockers. So alpha and beta blockers, and this is why they're not directly parasympathetic. These aren't binding to muscarinic receptors. They're binding to the same receptors as the sympathetic activity and epinephrine and norepinephrine. But instead of activating these alpha and beta receptors, they're blocking it. And what can you do to relieve sinusitis? So this is like for decongestants, and this is like pseudoephedrine and phenylephrine. I think I might have covered this earlier. But this is where we come back full circle. Like remember when we were talking about the sinuses in your skull? Well, what's going to happen with these agonists in at least the blood vessels inside your sinuses? It's going to shrink the blood vessels, thereby reducing blood flow, and this reduces mucus production in your sinuses and also prevents the accumulation of fluid as well, and blood and fluid in these tissues. So that's why when you do have a alpha-1 adrenergic receptor agonist such as pseudoephedrine and phenylephrine, this shrinks the blood vessels, thereby reducing the swelling and mucus production in your sinuses. That's why you can breathe better. Now with this, you might have also seen this with adrenaline. So adrenaline in the heart, like in so many movies, what they have is like, someone has cardiac arrest, they say, okay, I need epi stat, and they jab the needle in there, forget about any sterility, and this person immediately wakes up. So again, adrenaline is the same thing as epinephrine. So epinephrine, the natural sympathomimetic, or not sympatholytic, it's what we call endogenous. It's your natural ligand for the receptors of the sympathetic nervous system. So what's that going to do? Well, it's a beta-1 agonist. With the adrenaline, it's going to, and epinephrine, is going to increase your heart rate and cause stronger heart contractions. And that makes sense because if someone's heart is stopped, you want to get beating again. So this is why epinephrine is commonly given. And bronchoconstriction. So remember, bronchoconstriction is narrowing of the airways, and many diseases, especially asthma. Now, but there's other ones too, like emphysema, chronic bronchitis, COPD, and even exercise-induced bronchoconstriction. Sometimes this happens as well. So one way of undoing that is by opening up the airways, right? So actually, they do give a combination therapy, but that's more med school level. But one of the drugs they give are beta-2 agonists. And salbutamol, well, actually they swapped it, but again, I won't get into too much details, but this is one example. Yeah, let's talk about that. So what it's going to do when your airways are narrowed, you want to open them up. So with beta-2 agonists, salbutamol or albuterol is going to open up the airways. So again, if someone's wheezing because their airways are constricting due to asthma, you want to open it up, give them a beta-2 agonist. This is going to open up your airways. So this is short-acting, but actually they're going more for long-acting beta agonists. I have to update this slide later on. And okay, so what we have here is an allergic response. Now, this is a little more advanced. We cover allergies for actually, do we even have time next semester? Well, this involves the immune system. Don't worry about all of the immune system stuff right here. But what we have here is increased blood flow due to allergies, and also the blood vessels, they start to open so much that they also become a little leaky. And when you have this leakiness, all the fluid from our blood vessels ends up going to the surrounding tissues. Now, there's something that we call anaphylaxis. And so anaphylaxis is a medical term referring to what happens with a severe allergic reaction. And this is when the immune response, so the thing is that with the allergies, this is our immune system reacting to something foreign or something that causes an allergy. And what happens is it kind of goes extra, so you want to deliver immune cells to the area and thereby help those immune cell system by delivering more blood to the area. But if it kind of overshoots it, now you have too much blood going to that area. So the other thing is that anaphylaxis also causes bronchoconstriction. It's due to the swelling and also the constriction of this swelling of these airways as well. And a lot of these blood vessels all throughout your body start to dilate. So this can cause major swelling, like this poor girl right here. Like, yeah, this is not plastic surgery. She has some severe, I forgot where this source was, but yeah, look how puffy her eyes are, her lips, like that's not collagen injections, that is like severe anaphylaxis. Luckily, I think she recovered enough to post this later and admire her bravery, but yeah. But what happens if you have too much of this blood and fluid leaking out from these blood vessels to the surrounding tissues? Well, without blood and fluid inside your blood vessels, your blood pressure drops. It's like having a lack of water in your pipes. You're going to have a lack of water pressure. So this is why anaphylaxis can be potentially deadly. And if you don't have enough blood flow, you can also lead to your heart stopping altogether or cardiac arrest. So what's a common way of treating anaphylaxis are these epinephrine auto-injectors, or Epipens. And actually Epipen I think is a trademark one. Now they thankfully have generic versions because I think last time I checked it was like hundreds of dollars for the name brand. It was ridiculous. But if you look at Epipen, what does it do? And what it does is constricts blood vessels. Hey, constricting blood vessels. Therefore it's an alpha-1 agonist, right? Because alpha-1 constricts blood vessels. Beta-1 agonist, hey, where's beta-1? That's good in your heart, right? So it's one of the major ones that control your heart rate by increasing the heart rate and also increasing the force of contractions, thereby increasing the flow and circulation of blood. So increased blood flow. And beta-2 agonists. Beta-2 agonists, when you think of beta-2, easy mnemonic for beta receptors, beta-1, one heart, two lungs, right? So one heart, two lungs. So beta-2 is important in the lungs. It's going to open up the airways because why? With anaphylaxis and the severe allergic reaction, you have the wheezing, so you want to open up airways and you want to restore circulation. Or if you know like emergency medicines, like what's the ABCs? Airway, breathing, circulation. So yeah, this is what it helps with all of those in anaphylaxis. And what are the side effects? Well, you're going to have things like pounding heartbeat. Yeah, that's kind of what we expect, right? With beta 1 agonists, we're going to have increased heart rate, sweating, sympathetic activity, right? This is the natural sympathetic ligand, right? So we're going to have activating the sweat glands. Nausea or vomiting, that's a little more complex, but breathing problems, maybe you're over breathing or whatnot. Paleness, dizziness, weakness, shakiness. So again, what happens when you have sympathetic activity in the fight or flight response? Sometimes you get kind of dizzy, shaky, anxiety, nervousness. So this is your fight or flight system being induced by this auto injector. So it's not your nervous system, you're getting it from the outside, but it's causing the same activity like your sympathetic nervous system. Again, all those shakiness you get with sympathetic activity. So again, it's not random side effects. These are things we expect because why? We know what receptors epinephrine binds to. Therefore, where do we have the sympathetic activity? What are the effects of sympathetic activity? What could be potentially negative effects? That's why we have this laundry list of all this side effects with Epipen. But again, this is very important because again, if you're going to nursing, medicine, pharmacology, you gotta know this stuff. And these are powerful drugs, and this is why I love teaching about the autonomic nervous system because again, Epipen can be life-saving, works super quickly, and this is why a lot of the emergency department drugs are used to kind of like regulate the autonomic nervous system. Very powerful stuff, very useful.